Going on, everyone? Welcome to today's pandemic update for Thursday, May 4th, 2023. May the 4th be with you. Alrighty, before we get to today's pandemic update, a little bit of show and tell. If you did not catch yesterday's update, there is a COVID positive case in the household, which is why I am masking today. I don't care what you think about me masking, it's the right thing to do to slow the spread and to help keep me safe in this time. I also have the air purifier running behind me during broadcasting today. So, here's the show and tell. As of this morning, I am still negative. As of the time that I took the test, which is good. I probably am likely going to take another rapid test either tomorrow morning or Saturday morning, and I am considering getting a PCR test as well, just to be safe. Alrighty, let's get on with today's update. We do have a lot to get through today. First off, we look at India like we always do. 3,962 new cases have been added, along with 22 new deaths. There's also something else we need to take note of here. And they do mention the WHO experts' small COVID emergency status. What does that mean? Well, what that means is the WHO is going to have their 15th panel meeting to decide whether or not COVID-19 is still a global health emergency. Now, if I was on the WHO panel, my suggestion would be taking a look at how these variants are still emerging so rapidly. I mean, we're not even through with XBB.1.16 yet. It's just starting to rise in the United States, and there's already something else behind it. There's the XBB.2.3, which is now rising in numbers over in India. So the fact that these variants are emerging so quickly, and the fact that any given one of them could change the ball game and pretty much just break through all the progress we made so far and become more severe and increase hospitalizations, deaths, and so on. To me, that means it's still an emergency. Until we can slow down the development of these new variants, it is considered an emergency in my opinion. So you'll want to stay tuned to my Twitter or even here. When they do give their update on what they're going to do, I will tweet it out and I will update it here in this video. But as you know, sometimes we have to wait several days until after a meeting to find out what the WHO decides. So if you're new to my channel and you want to see this update, which hopefully I'll have in tomorrow's video, hit that subscribe button down below and I will update you on that. Moving on to this from Iowa. It's getting to be the season of track and field. We'll be having our Penn relays here in Philadelphia pretty soon. I believe it's either sometime this month or in June. It draws thousands and thousands of people. It's sure to be a COVID super spreader. Well, there is a COVID super spreader ongoing right now in Drake University. This is in Iowa. And there were 5,000 high school, college, and elite level competitors. 40,000 fans at the 113th annual event. Well, already 76 have tested positive, and we know due to false negatives, lack of testing, or people just not getting tested at all, that's likely an understatement. So this is a real concern, that these big events are still causing super spreaders, and it just goes to show you how much we undercount the cases in this country. Because every day there are large events going on. Remember, this is track and field. This is an outdoor event. So people attend baseball games, people attend concerts, soccer matches, in the fall, NFL, anything that's outdoors. This is telling me there are still numerous cases going on at these events, and we're just not catching them all. This really shows how much we are missing cases. Alright, moving on. Infectious outbreak shuts down school daycare after spread of mysterious illness in Detroit. This is really bad. It may not seem bad at first because, I mean, how many mysterious illnesses have I reported on since we started doing these videos? Quite a few. Or at least since we changed over to more of a news format, adding into the data portion of these videos, and this one's bad because there has been a death with it. The Detroit Health Department monitoring nearly 25 cases. Children started getting sick in the middle of last week at Gravy Academy and the Focus Hope Center for Children. Now Gravy is closed for deep cleaning until May 8th, and the Center for Children was closed May 2nd and will be closed Thursday for cleaning. 25 children are ill. A kindergartner from Gravy has died. One child is hospitalized, and another has been released. Let's continue on down here. And it says, no one is sure where the illness was coming from, but the symptoms, according to the Detroit Health Department, include high fever, headache, lethargia, nauseous, vomiting, and abdominal pain. So we don't have a name of the virus, but sounds pretty serious if you ask me. Alright, moving on to this now. Another mysterious illness. This time into MLB. The MLB is having its world tour. So some games are being played in various different cities, such as Mexico City. And San Francisco Giants, P. Logan Webb says, 75% of the team has the runs, constantly going to the restroom. And this was after a Mexico trip, so this is interesting. And you have to wonder, maybe it was something in the water. We know some countries, they advise do not drink the water. I don't know, I'm just speculating. But it's something, if we get an update on it, I will bring it to you. Moving on to this. Now, how many times have we updated on Jamie Foxx? At least 5 or 6 times. We know it possibly could have been a stroke, but there was only one source saying that. And this person's saying, this is Brandon T. Jackson is saying, as a friend, I'm scared. So that's not good that he's saying that. And we have to remember here, Jamie Foxx has been in the hospital for over 3 weeks now. We know hospital transmission of COVID is real. So who's to say he couldn't also acquire a COVID infection while in the hospital all this time? Or any one of the people who have come to visit him all this time, because I don't know if he's outside of the hospital here, Brandon T. Jackson, but I don't see a mask in sight. Hopefully they're masking with Jamie Foxx. Alright, moving on to this. This was a question I asked last night. If you have a family member die of COVID, would you take COVID more serious? I guess I should have been more specific. I was really trying to lean towards the people that are just living like it's pre-pandemic life. But you know what? Here's what the results said. 82.4% said yes, 17.6% said no, but a lot of people gave the explanation that no, I already were taking it serious. So again, my fault for not being more specific, but you know what? 82.4% say yes, so I mean, that's a pretty big number if you ask me. Alright, moving on to the data portion today. We have nothing in COVID history. Here's wastewater. As you know, 3 of the 4 regions are rising. The biggest rise we see is in the Midwest. We'll probably have a wastewater update. Our next video for that will likely be sometime over the weekend, providing data does not go missing. Here's what it looks like on the CDC map, and you can see here there's a lot of blue here. There is some orange mixed in. As you know, orange is moderate to high. The real light color of blue is low to about moderate levels, and the darker blue is low levels. And as you can see, the majority of the moderate areas are in the Great Lakes region, which makes sense that as a region it is rising. I should say Midwest region is rising. Alright, moving on to transmission. 573 counties are high, 410 are substantial, 1,516 are moderate, 624 are low. The top variants are XBB.1.5 at 68.8%, XBB.1.16 at 11.7%, and XBB.1.9.1 at 9%. Alright, moving on to our next portion today. Here's BNO. We do have an update from BNO. 36,038 new cases reported yesterday. The average is 12,177. That's down by 1,531. States reporting, we had 25, which is normal for Wednesday. In the hospital, 12,802. That's actually down by 326. In the ICU, 1,688. That's down by 40. New deaths, 443. The average is 217. That's down by 3. Moving on to New Jersey here, and in today's New Jersey update you will see that cases are at 227 new cases, 116 new probable cases. Moving on to hospitalizations. In the hospital today, they have 187 people in the hospital, 9 people on a ventilator. In the ICU, they have 24 people. Alright, moving on to my state of Pennsylvania. There's a couple things I want to show you here. The hospital situation in Philadelphia County, 38 people are hospitalized. Allegheny County, Pennsylvania, slightly higher than Philadelphia, with 40 people in the hospital. Then we come down here, let's just show you the whole statewide. 259 hospitalized people, 23 people in the ICU, 20 people on a ventilator. But I want to show you Clearfield County, Pennsylvania, because there's something going on here. And this is something I've been saying for a long time. Notice how, as of the update yesterday, they had 11 medical and surgical beds available. Now, there's 2 hospitals in Clearfield County. There's Penn Highlands Du Bois, there's Penn Highlands Clearfield. Chances are the 11 that you see here, the majority of those were available in Penn Highlands Du Bois, because last night Penn Highlands Clearfield did have to go on divert status. And remember what I've been saying here. Just because it says there's 11 beds available doesn't mean they have the staffing for 11 beds. So for some reason, whether it be the hospital being full, which is likely what it was, they had to divert Penn Highlands Clearfield. I know that because I was listening to Dispatch last night, and they announced a divert status. Alright, moving on to this. Here's Center County, Pennsylvania. We don't have an update out of there yet for today. I could show you back on the other page, but that would have been the same update from yesterday, because Pennsylvania updates on Wednesdays. Alright, taking a look at today's cases in New York State, we do have 528 new cases to report on in New York State for the 4th. And test positivity rate is 1.9%. The 7-day average is 1.5%. Taking a look at hospitalizations in New York State, as of the 3rd, they have 599 people in the hospital and 63 people in the ICU. That is a considerable drop from yesterday's 645 people that are in the hospital. In case you did not see it yesterday, here is the update out of Texas. Let me refresh this. 3,519 confirmed cases yesterday. New probable cases, 3,065. 6.19% positivity. Still 51 deaths. And remember, 1 death is too many deaths. Taking a look at the hospitalizations, 900 people hospitalized and 162 people in the ICU. Let's look at some international numbers. I'm going to refresh this as some data may have updated since I last looked at it about a half hour ago. South Korea, 10% increase in cases, 2% decrease in deaths. Japan, 17% increase in cases, 3% decrease in deaths. Then we come down here to India, 46% decrease in cases now, 6% decrease in deaths. Russia, 20% decrease in cases, 5% decrease in deaths. But we have some countries where deaths are definitely rising. Vietnam, 16% decrease in cases. Now they're up to 7 deaths in the last 7 days, so that's a 250% increase over the 2 that they had before. Remember, it starts off with small numbers, and it could end up getting bigger. That's what happened with India. Taking a look here at Indonesia, they have a 96% increase in cases now, and a 185% increase in deaths. 148 deaths versus just 52 deaths, so that is a fairly significant number. Mexico, 20% decrease in cases, 10% increase in deaths. And we'll end today on the Philippines, where there is an 88% increase in cases, and no deaths have been reported this. Alrighty, that does it for today's pandemic update. My final message to you is you need to continue testing often to check to make sure that you are negative for COVID or don't have COVID. Even if you just have a cold, check and test for COVID. Also, you need to continue wearing a mask everywhere. COVID is not done with us. As you see here, we have a COVID positive case in the house. Trying my best to stay safe. Again, I have tested negative so far. We'll see what happens on the next test, either tomorrow morning or Saturday morning. Probably tomorrow morning. And hopefully it stays this way, that I stay negative. Alright, if you like this video, give it a thumbs up. If you want to see more content like this, hit that subscribe button down below. I'll see you all again next time. Have a great afternoon, but most importantly, stay safe, everyone.